Hello everyone, how are you doing? This is MICFA Clinic by Dr. K. Today we are going to revise pneumonia in pediatrics. I have prepared this video based on the following references. The first one is Nelson Pediatrics 21st edition. The second one is WHO Pocket Book of Hospital Care for Children, 2nd edition. Pediatrics Hospital Care of Ethiopia, 2nd edition. MedStar Pediatrics 2nd edition, Farnos Pediatrics 1st edition, Dream Pediatrics 1st edition, Pediatrics and Child Health for Health Science students, Lecture Note 1st edition. So we will summarize all the information about pneumonia in pediatrics age group, which means the definition, etiology, epidemiology, clinical manifestation, investigation, management, complication, and prognosis from all these books. So you are not obliged to read all these books. By simply watching this video, you can get adequate information about pneumonia in pediatrics age group. Let's start our discussion with two famous quotes. The first one is the one which is quoted by the Babylonian Talmud. Whoever saves one life, it is considered as if they saved an entire world. The second one is Sir William Osler once said, pneumonia is the captain of all the men of death. So today we are going to discuss and we are going to have all the informations about this captain of all the men of death, which is pneumonia. So let's start with the definition of pneumonia. Pneumonia is inflammation of the lung parenchyma. Lung parenchyma means the gas exchange area of the lung, which is the alveoli and the respiratory bronchioles. So when we come to epidemiology of pneumonia, pneumonia is the most common cause of mortality and morbidity on under 5 children. Don't forget this. Pneumonia is the leading infectious cause of under 5 children, which accounts about 920,000 children died yearly below the age of 5 years due to pneumonia. The developing nations account the larger portion. Almost 99% of these deaths occurs in developing nations, which means Africa and Asian countries, and some of them in Latin America. So from this we can understand that pneumonia is one of the preventable cause of under 5 mortality. And when it comes to our country, Ethiopia, the most recent information that I have is pneumonia accounts for almost 1/3 of infant mortality rate and about 1/5 of under 5 mortality. So it is a major concerning problem especially in developing nations. If we say this much about the epidemiology, when it comes to the etiology of pneumonia, the most common cause of pneumonia is infectious, which means pneumonia can also occur due to other non-infectious causes like aspiration. Aspiration can be one is the secretion of our body, including the saliva, the gastric secretion, or mucus, or sometimes blood due to trauma involving the face, the neck, or the aspiration can be a foreign body and foreign chemicals like hydrocarbons, lipoid substance. All these can result in chemical pneumonitis or aspiration pneumonia. So considering as etiology, it can be infectious or non-infectious, but the most common cause of pneumonia is infectious causes. So from this infectious cause of pneumonia, one of the major causes of pneumonia are viral causes. Virus contributes to the major contributors of pneumonia, and from the viral causes, the most common causes are respiratory syncytial virus, RSV, and the second one is adenovirus. But other viruses like coronavirus, influenza, parainfluenza is the one which is associated with croup, and RSV, which is associated with bronchiolitis. All these viruses can cause viral pneumonia. The second and most common cause of infectious cause of pneumonia is bacterial causes. One thing we should know is usually viral pneumonia are self-limiting. However, bacterial pneumonias are serious. They may be associated with complication and death. So it is the one that we should give attention, and it is the one that we are going to intervene or manage. So from the bacterial cause of pneumonia, among the most common cause of bacterial or etiologic agents for bacterial pneumonia are: one is Streptococcus pneumonia, the other thing is atypical pneumonia, or the one which you call it a febrile pneumonia, which is caused by chlamydophila pneumonia, mycoplasma pneumonia, ureaplasma urealyticum, and the like. And additionally, Staph aureus, H. influenza, especially the one in children who are not adequately vaccinated or who are not vaccinated at all. H. influenza type B can cause pneumonia. And Staph aureus is usually associated with severe form of pneumonia, and it may be associated with the local and systemic complications. Additionally, Staph aureus infection is usually followed to the phase associated with, or they are usually followed H. influenza infections. So if we know this much about bacterial pneumonia, the third most common infectious etiology for pneumonia are fungal causes. Usually fungal causes of pneumonia are associated or occurs on children with severe immunosuppression, especially children with RVI or children with a congenital cause of immunodeficiencies. They are at risk of developing fungal pneumonias. This includes histoplasmosis capsulatum, Cryptococcus neoformans, and blastomycetes epidermidis. All these fungal causes of pneumonia can occur on children with severe immunosuppression. The other group of infectious cause of pneumonia is Mycobacterium. Mycobacterium tuberculosis, Mycobacterium avium complex. Actually, this is a special form of pneumonia. Tuberculosis is considered as a separate disease entity because the clinical course, the management, and in general the nature of the disease is completely different from the other types of bacterial pneumonia. HIV-positive children have special groups of etiologic agents, and this group of children, this includes: one is tuberculosis, the other thing is MAC or Mycobacterium avium complex, the other thing is PCP, and cytomegalovirus, Salmonella, E. coli, and the one which I have mentioned, the fungal infections, are commonly associated with RVI or HIV infected children. Sometimes atypical pneumonia can occur, especially on children above the age of 5 years old, school-aged children, so one who are engaged in playing in groups, or the one who attends on daycares, at risk of developing this atypical pneumonia. Atypical pneumonia is caused by mycoplasma pneumonia, chlamydophila pneumonia, and chlamydophila pistacei, and the like. So usually these are called atypical pneumonia because the etiologic agents are atypical, the clinical manifestation is atypical, and usually they have non-pulmonary clinical manifestations, and usually they may not have fever, chest x-ray finding is normal, so all this make them atypical. So there are antibiotics that you should have considered when you consider atypical cause of pneumonia. So if we say this much if we list out the etiologic agents, now let's classify them based on the age of the child. So in neonates, the most common etiologic agent for pneumonia is GBS, group B Streptococcus, and E. coli. Additionally, strep pneumonia, H. influenza, and viral causes also may contribute to the pneumonia in this age group, but the most common one are GBS and E. coli, because these infectious agents are acquired from the genital tract during delivery. So don't forget that in neonatal age group, we do not diagnose pneumonia because neonates are they are unable to confine infection to certain organs. If they develop pneumonia, it will easily leak to their blood, so they will develop sepsis. So always in neonatal age group, infection is managed as sepsis. So neonatal sepsis is a separate topic. it's a separate bedside, and we will discuss it in the future. So for now, as a long focus of infection, the common etiologies in neonatal age groups are GBS and E. coli. After the neonatal age, which means from 1 month up to 3 months, the most common causes are associated with viral causes of pneumonia like RSV, parainfluenza, influenza virus. Additionally, bacterial causes like strep pneumonia, H. influenza, and sometimes chlamydia trachomatis can be the etiologic agents in this age group. From 3 months up to 5 years, common cause of pneumonia are strep pneumonia and H. influenza, and mycoplasma pneumonia, and the viruses like RSV, influenza, parainfluenza virus. So up to the age of 5 years, viral pneumonia is common. But after the age of 5 years, 5 years up to 18 years, strep pneumonia, mycoplasma pneumonia, chlamydophila pneumonia are among the most common cause or etiologic agents for pneumonia. So, and after the age of 18 years, the etiologies are almost the same: strep pneumonia, mycoplasma, and Moraxella catarrhalis, and additionally, occasionally, the viral cause of pneumonia can be the etiologic agent or the cause of pneumonia. The purpose of classifying the etiologic agents based on the age group is the choice of antibiotics depends on their age group, because, as I have mentioned earlier, there is no definitive diagnosis for the etiology, or there is no definitive way of identifying the etiology in pneumonia, because if we want to know the exact etiology for a certain patient, we need to do an invasive procedure. We need to take a lung sample and culture it. So based on that, we may identify the etiology, but this procedure is invasive, and sputum doesn't tell us the lower tract infection. So doing this invasive procedure is unacceptable. So rather, we will manage empirically based on these age groups. So for neonatal age group, for under 5 children, or for children above 5 years, the choice of antibiotics is different. So that's the main reason that we should know the common etiologic agents in specific age groups of the child. If we know this much about the etiologic agents, let me give you a few additional points about the etiologic agents. One is the leading cause of hospitalization and death in developing nation results from infection caused by strep pneumonia, H. influenza, type B, and Staph aureus. So from these three, the two, strep pneumonia and H. influenza, are their preventable cause of pneumonia, especially by vaccination. Now let's come to the pathogenesis behind pneumonia. It is straightforward. Our body have different protective mechanisms from infectious agents. So the protection begins from the nose. In the nose there are cilia mucus, so it will trap the droplets which tries to enter to the airway. If it bypasses this protective mechanism, then our respiratory linings contains immunoglobulin IgA, and it has its own role on protection against infection. There is also mucociliary functions, so this mucociliary mechanism will expel any foreign agents out of the respiratory tract. And finally, if it reaches to the alveolar, in the alveolar there are specialized macrophages, which are alveolar macrophages, so they will engulf the infectious agent and remove that infectious agent from the respiratory tract. So these are the levels of protections of the respiratory tract. So if the respiratory tract is protected by this way, in order to develop the infection, the infectious agent should bypass these protective mechanisms, and finally the child will develop features or symptoms of pneumonia. So there are different infectious agents bypass these protective mechanisms by different ways. Let's mention few of them and we'll proceed with the clinical manifestation. In case of viral pneumonia causes usually respiratory epithelium injury. So they will injure them, the injured epithelium will become edematous, and it will increase its secretion, and finally it will die. So that cellular debris will obstruct the smaller airways, and it will provide a fertile ground for bacterial proliferation. That's why 1/3 of viral pneumonias are complicated by bacterial pneumonia, because the virus will provide a fertile ground for the proliferation of the bacteria. So finally it will obstruct the smaller airways. This will result in ventilation perfusion mismatching, which means the blood will pass the lung without being oxygenated. So that mismatching will cause respiratory distress, cough, shortness of breath, and the like. The other etiologic agent is strep pneumonia. Strep pneumonia, in the same way, injures the respiratory epithelium. The epithelium becomes edematous, and it will also result in necrosis of the mucosa. So this will result in obstruction of the small airways. Staph aureus, usually it will cause unilateral bronchopneumonia and causes usually it's associated with severe form of pneumonia. Chlamydophila pneumonia, it will impair mucociliary function and cause mucosal damage, and finally it will obstruct the smaller airways. The other thing that we should know is, previously it was taught that the lower respiratory tract is a sterile environment, which means free of any microorganism. So a child or a person develop pneumonia due to invention of this sterile environment by microorganisms. But currently it is believed that there are microfloras there. So pneumonia results from disruption of this low respiratory ecosystem. Rather than considering it as sterile, there are microflora. So when there is disruption within this microflora complex, it will result in pneumonia. So these are the basic things that we should know under the pathogenesis of pneumonia. The other thing is, there is what you call it recurrent pneumonia. When do we diagnose recurrent pneumonia? Recurrent pneumonia is by definition the presence of two or more episodes of pneumonia per year. If a child encounters 2 episodes of pneumonia per year, then you should diagnose it as recurrent pneumonia. Or if the child develops 3 or more episodes of pneumonia in the whole childhood life, or regardless of the year, if the child encounters 3 or more episodes of pneumonia, then we should consider as recurrent pneumonia. So why do we diagnose recurrent pneumonia? Because there is certain predisposing condition for the child to develop that recurrent pneumonia. That predisposing condition can be, one is it can be from congenital immunodeficiencies like SCID, severe combined immunodeficiency, or it can be IgG deficiency. It can be, there are syndromes like Job syndrome, cystic fibrosis, or sickle cell disease. So a child having these problems congenitally might be attacked by recurrent pneumonia. Or the problem can be from acquired infections like RVI. So we have to screen for RVI. And the child may have some problems like mucociliary dysfunctions, which results from like Katagner syndrome. Or the problem can be anatomical problems like GERD may cause recurrent pneumonia, or foreign body aspiration. If that foreign body is not removed, the child is frequently attacked or frequently develop pneumonia. Or it can be from tracheoesophageal fistula. Unless that fistula is repaired, the child is at risk of aspiration through that fistula, so you will continuously develop recurrent pneumonia. So whenever you diagnose recurrent pneumonia, try to consider this differential diagnosis and try to work up with this differential diagnosis. So this is the things that we should understand under pathogenesis of pneumonia. Now let's come to the clinical